Following Lisa Bang from Columbia University and Ian Lapp from Harvard University, today the college is very pleased to host Dr. Lisa Sullivan, Associate Dean for Education and Professor and Chair of the Department of Biostatistics at the Boston University School of Public Health. I think we kind of saturated all the Massachusetts, New York, East people. But anyway, often our students want to know the background of our leaders. So I'm going to do some introduction of Lisa. Lisa received a degree in mathematics from University of New Hampshire, a master and PhD in statistics from Boston University. After being a biostatistician at the Primary Care Outcome Research Institute at the New England Medical Center, or school.
Medical Center.
Center, yes. She joined the faculty at the School of Public Health about 18 years ago. So what is Lisa's day job, let's say? She teaches biostatistics for MPH students and was instrumental in developing a minor program in public health, which is open to undergraduate students at Boston University. She is the principal investigator of the Summer Institute for Training in Biostatistics, sponsored by the National Heart, Lung, and Blood Institute, which is designed to promote interest in the field of biostatistics and its many exciting career opportunities. For those of you who think statistics is boring, she can tell you there's a lot of other things. I finally got some chance to talk with you. It's really interesting. She is a co-author of a textbook entitled Introductory Applied Biostatistics, author of Essentials of Biostatistics in Public Health, currently is in the second edition, and co-editor-in-chief of the Encyclopedia of Clinical Trial. She is recipient of numerous teaching awards. Let's just put it this way, if they got one award, she gets it. So she, including Excellence in Teaching Award from the School of Public Health, I think there are a couple of them, from the Boston University, I think there's one, and then from the Association of Schools and Programs of Public Health for teaching excellence, and then from American Statistics Association section on teaching statistics in health sciences. And she was named the Mosteller Statistician of the Year. Okay, then this is a long list. I'm for one more. And she also won the Massachusetts American Council on Education National Network of Women Leaders Leadership Award. So she really been awarded many. So you can tell she's outstanding in teaching. She also is very active in multidisciplinary research projects. I'm not going to list all of them, just kind of share some of that with you because then you know the area of her interest is including in cardiovascular disease and also the assessed association between alcohol exposure in pregnancy and the sudden infant death syndrome. Also studied the improved method for prenatal diagnosis and the clinical trial to improve in repetitive behaviors in children affected by autism. And she published nearly 200 papers. So, I'm sorry, I'm just being facetious. 200, I don't know how to get there. So, in her spare time, she serves on the MPH expert panel of the Framing the Future Task Force convened by the ASPPH and is leading the MPH Curriculum Integration at Boston University School of Public Health. So today she's going to talk about MPH, the MPH in the 21st century. So please help me in welcoming Dr. Sullivan.
Thank you for having me here. It's nice to be here. So many people. I know food does make a big difference. Same at our place. There are seats in the front for some of you. This is not a biostat class, so you can come down front. Okay, so what I'd like to do is tell you about some of the things we've been doing at Boston University, but first start with some trends, what's been happening in higher ed in general, which you may know about, some of the efforts nationally to look at the Master of Public Health. And you've heard from Melissa Begg, you've heard from Ian Lapp, they're involved in a lot of these things, but I'll tell you what I've been involved in. Just go over the Association of Schools and Programs of Public Health Framing the Future Task Force, what that was set up to do, and in particular focus on the MPH. There was an expert panel that was formed to focus on the direction of the MPH in the future, summarize a little bit, maybe more, about what happened at these national conferences that were held at Columbia and at Harvard on the future of public health, and then I'll describe in some detail what we're up to at the Boston University School of Public Health. Please feel free to interrupt me at any time. Just stop me. I will get excited in this and just keep rolling, but I'm happy to stop at any time and go into anything that you might want to talk about. So just in terms of higher education, a lot of things have been happening, and this is not to do with public health or even graduate education, but demographics have been changing. Enrollments are projected to grow more slowly than they have been in the past, and there will be more diversity in our classrooms. There is an increasing concern among our students, our prospective students, about the value for their tuition dollar. People are expecting to get more from their education across the whole spectrum. And there's a tremendous concern about student debt. People are really worried, are they going to be able to go out and get the jobs to get out of the debt that they incur when they're going through their educational programs. There's a lot of focus on measurement, a lot of accountability. So we in higher ed are accountable to funders and to our accrediting agencies to demonstrate that what we're doing is effective, and there's much more on that. Students are expecting more in the way of career preparation, and that's not just in professional programs. We're focusing today on the MPH, which is a professional degree program, but even in academic programs, even in liberal arts education, people are worried about, what am I going to do with this? Am I going to be able to get a job? People can get data all over the place. Data is everywhere about schools and about programs. And there's a lot of concern about transparency and trust in the data that they can get from all of our websites. So we have to be very careful about what we put there and whether we can stand up to what we're advertising in our programs. And there's a lot more competition. I know you are now in the SOFA system, and that's the Common Application Pool for Public Health, and there are lots of schools in there. There's much more competition for strong students in all of our programs of public health, and we have to make sure that we're offering the best possible programs to serve them. This slide just tries to describe the shifting paradigms in education. So thinking just about teaching and learning, we're shifting away from teaching, what we can do, to really what the students have to learn. And the foundational knowledge, to what they can actually do with that information. Can they apply the skills to problems that are relevant? Away from faculty-centered education to student-centered education. It's not so much what I think I ought to be teaching you. You have to be able to meet the objectives of the course. And that may take various pathways. People may get there in very different ways, and it has to be on the student to do that. Curricula have to move away from discipline-based to more integrated, and I'll talk to you about that. Away from content to competencies, and we'll talk about that when we think about how the MPH ought to be structured in the future. And this last one is hard in terms of planning and strategy, not so much what we can do. Often schools offer programs that fit what the faculty can do. But really, we ought to be thinking about, what is the demand for our graduates? You know, are they going to have jobs when they go out there? It doesn't really matter that I know biostatistics and I may be able to transmit that. Do people need that when they actually go out? And that's what we have to focus on. In graduate education, enrollments over the past about 10 years have gone up almost 5% each year. And about half of those have been in education, business, and in the health sciences. And lots of that energy is in master's level programs. And so this is exactly where we are all positioned right now. So there's a lot of interest in the work that we're doing, particularly at the master's level. There's a lot of interest and growing interest in public health. This just shows the applications as they've increased. This comes from the Association of Schools and Programs of Public Health. The first big jump is when SOFIS was introduced. And there may be another big jump as this continues when we get recent data because the programs have now entered into the SOFIS system. But there are lots of people who are interested in public health, which is good for all of us. And in terms of master's degrees at schools of public health, the MPHs have risen quite dramatically, almost a 50% increase over 10 years. And schools of public health are similar in terms of their diversity. Many of the schools have about 2/3 or so female students and 15% internationals. And that's fairly consistent across schools of public health. Tuition costs and debt burden is extremely important for students in schools of public health because many don't go on to earn extremely high salaries. I'm sorry if I'm breaking news to any of you MPH students in the audience. But it's difficult. So tuition costs are high and the salaries are not really catching up to some of those debts that we're building up. And there are fewer non-loan financial options for students. And this gets into the accreditors, what's available financially to support these educational offerings. And there are more regulations. And so there are lots more constraints on the system for the institution and also for the students. So that's just the backdrop, the landscape. It's been changing quite a lot and quite dramatically. But at the same time, there's been a lot of energy focused on the MPH program. It's a program with a lot of interest on the part of students and a lot of potential. There are a lot of jobs out there for students with MPH. And the job options available to graduates with MPHs are much wider than they ever were before. And so that, again, puts more burden on us as we develop programs to be sure that our students have the preparation to take part in those different jobs that are now open. So this is just an outline of a little bit of a timeline. So the Association of Schools and Programs of Public Health formed a Framing the Future task force in October 2012, and I'll tell you what they were all about. There was a conference held at Columbia in June of 2013 that brought together leaders in all of the schools and programs of public health, and we talked about where the future of the public health education might go. The Association for Schools and Programs of Public Health also conducted a Blue Ribbon Public Health Employers Advisory Board survey to get from the employer's point of view, what are they looking for in MPH graduates? And I'll share with you some of those details. And that's what we really have to focus on as we train students, make sure that we're setting them up to be well positioned to take the jobs that are out there. There was another conference held at Harvard in November of 2013. It was really in celebration of their centennial, but it was focused on education and public health. And the MPH expert panel, which was one piece of this Framing the Future task force, released its final report in December of 2013. And I think you've all seen that, or many of you have seen that. So the Association of Schools and Programs of Public Health put together this Framing the Future task force to really look at the role of education for public health. And this was across the whole educational continuum. And it was a good time to do it because it was about 100 years after the Welsh Rose Report. But a lot of things had been changing that really required a look at the whole continuum, one of which is a literally explosion of interest at the undergraduate level in courses, programs, and degrees. Some schools offer majors in public health, some have minors in public health, lots have courses, a survey course, an introduction to public health. Never before have we seen such interest in public health at the undergraduate level. Even grade school students are now understanding, knowing what public health is and becoming interested in the field. There was also a shift. This came mainly from our accreditors, but we are not brand new to this, competency-based education. So business schools, for example, have really always been involved in this, assurance of learning. And now we are required to do it, but it makes sense for a professional degree program. And as I said, there are lots more career options for students with training in public health. The range of possibilities that our graduates enter is much broader than it ever was before. There are also changes in educational technology and in teaching styles. We can talk about that. And in terms of competition, there are many more accredited schools. About 51, it sort of depends what day you count. How many schools, it changes. You'll be 52, okay? And programs, about 100, yeah. So there are a lot of schools and programs, and it'll serve the needs of the students, but there's competition for all of us to be as good as we can be in our programs. So this is just one slide on an extensive report. You can get this report if you're interested from the ASPPH website, the Blue Ribbon panel, the employer survey. But essentially, this was to get from the employer's perspective, what is it that they're looking for in graduates from MPH programs. And they felt that the core value of public health is its commitment to population health. That cannot be lost. And they want to make sure that no matter what we change in our curricula, that we always maintain that focus. There was also an expression that the public health system and the healthcare system have to come together. Those systems have grown increasingly apart, and they have to work together. Again, opportunities for public health workers are broadening, and there's, in addition to the core tools that we can talk about that we all have always offered, we have to give students skills in analytics. There's all of this big data, whatever that means. It means different things to different people. Students have to understand and be comfortable working with data, and also have to understand how law and policy affect public health. They were also asked what they felt were the essential elements of public health education in the 21st century. And they listed things like problem solving, management and teamwork, global perspective, policy, analytic methods, and so on. Now, as they listed all these things they would like to see graduates have, they had no constraints in terms of how much time they're with students, no credit hours, program length, finances, anything like that. So this is their wish list, although you can't really argue with many of these things that are on the list. And then at Columbia, I know you heard from Melissa Begg, but Columbia held a very nice conference, and there were lots of people in attendance, and we heard about innovations in public health education, how we need to change. And in a way, as we think about our curricula, think about what the workforce is going to need 15 years from now or 20 years from now. And that's hard to do because the environment is changing. How do we know what's really going to be needed then? But realistically, when we make changes in curricula, it takes a lot of time for us to get the approvals that are needed, to set up the programs, to get faculty on board with what those changes want to be. But we have to keep doing this. We have to keep looking forward. And then we heard from Howard Koh, who's the Assistant Secretary for Health, and he talked about the future of the public health workforce. And I have to tell you that at this conference, our dean was there, as was I, and Howard Koh actually got an MPH from Boston University. And as he gave his talk, he said, I did get an MPH, I can relate to this, but this is what an MPH really ought to include. And as he was saying it, he was looking at our dean saying, and I didn't get it in mine. And he was saying things like, I really needed more training in leadership and how to work, in a political landscape and everything. And our dean went up to him afterwards and said, Howard, we don't train our students to be the assistant secretaries of health. So I think he sort of overshot what he was really looking for in the program.
Do you remember the P's?
7 P's.
Yeah, the 7 P's. Politics, I can't remember all of them.
Policy.
Procurement, I forgot it.
Yeah, I have it in my notebook, yes. But yeah. But his whole, what we heard was he didn't get what he was looking for. Yeah. And then we talked about different ways that people are trying to address the needs for our students in terms of teaching critical thinking, which is not an easy thing to do, system science, and there was a lot of discussion around integrated core. Marie and I attend the Associate Dean's meetings, and a lot of schools are thinking about this, trying to figure out the best way to put together a core curriculum that works for the students. And then some methodological innovations in education, incentivizing teaching, case method teaching, the flipped classroom, and we heard a lot about distance ed in these massive open online courses. And then the whole issue of measuring competencies. How do we know when we do anything, we change anything, that it actually works? And that's where I'll get to when I tell you what we're up to at Boston University. A lot of our faculty are asking the question, as they should be, how will we know what we're doing is any better than what we're doing right now? And that's really a challenge. That's something we have to think about. We have to apply all of the research science that we understand to education. And there's not a lot of data out there on how to measure educational change. And then the deans at several of the schools were talking about the future. And then there was a nice symposium also held at Harvard that same year, and we heard from their dean talking about the changes in their curriculum. Harvard has had a very strong MPH program. It's mostly been geared to clinical professionals, so MDs and nurses and dentists, other people with a medical background, and they take on the MPH in addition. But now they're expanding their program to include many students that you and we would take into our program. So they're thinking about the program also. And there's a nice video that I know some of you have seen that you might want to watch. Their whole program is up, has been taped, and it's all put up if anybody has the time. And so all of this is happening. These big conferences are happening. And then at the same time, we had this expert panel, and it happened to be chaired by our dean. And it involved people from many, many schools. It also had a representative from CEF, our accreditors. So as I go through what this panel is going to recommend, you'll be thinking, well, how's that going to translate into what CEF is going to be asking us? There was the deputy director of CEF particular panel focused on a couple of things: the key considerations for the MPH program, what it ought to look like in terms of some design features, and what should be included in the core. And we struggled a lot with how specific to be in terms of this report. The report we did not want to come out and say every school has to do 1, 2, 3, 4, 5. It was meant to give some guidelines to frame where the MPH is focused on. And one is clearly distinguishing the MPH from the bachelor's degree and from the DRPH. Now, those of you involved in DRPH education, our director of the DRPH says if you've seen one DRPH, you've seen one, because they're all different. And so the DRPH is at one end of the spectrum, the bachelor's degree is at the other, and the MPH has to be positioned somewhere in the middle. And there's a blurring sometimes of what the MPH ought to look like. Some people talk about the MPH, and we want to build leadership skills, as Howard Koh wished he had gotten in his MPH. That's really, he was describing more of what we offer in our DRPH, and maybe some other schools also. So we really wanted to be sure that the MPH had a place and that it was clearly positioned along the educational spectrum. There was a lot of talk about making sure the MPH was more skills-based, more depth than breadth. And this is a difficult thing because public health is a very broad field. And we really tried to change our thinking a little bit in this and talked about building on what the employers were looking for, more skills, but not completely eliminating the breadth, which is extremely important too. So this is a really difficult balance to try to reach. Wanted to just reinforce that the MPH is a professional degree. So as you talk about putting more depth in the program, some people start to say, well, are you changing it to an MS? And the answer is no, it still has the breadth piece, the core piece to it, and so it's definitely different than an MS degree with the professional focus. It's designed for people who want to do public health practice, as opposed to, the academic degrees tend to be oriented to people who want to focus more on research. Not that our graduates don't go into research, they do, but the training is structured slightly differently. And the MPH has to be more integrated and dynamic to adapt to changes in the workforce. And this is really difficult in large institutions and complex institutions. As things change, we can't always react to them as quickly as we'd like to just because of the structures that we work within. The concentration was highlighted as being the key feature of the MPH. And there was a lot of discussion that each concentration, now again, whatever concentrations you decide are appropriate for your school, they should include sequential coursework so that students can build depth and build mastery and be focused on the skills that are needed for that particular job or career. And here it said explicitly, schools and programs can determine the concentrations that they see fit. And it's perfectly fine if a particular school or program wanted to offer a generalist MPH, if that's what students go into, if that prepares them for the type of work that's needed. And we talked about not requiring schools offering concentrations in the 5 traditional areas. We also discussed that the practicum and culminating experience ought to be tied more to the concentration. Some schools do this now, but the criteria from CEF aren't completely clear on this. They don't tell you right now that they have to be tied to the concentration. Some schools and programs have their practicum and culminating experience more program-wide as opposed to linked to the concentration. And here we're saying it ought to be primarily linked to the concentration. Each MPH program should have a core, and that should be common to all programs, so that if we offer an MPH and you offer an MPH, regardless of what concentration our students selected, they should have some way of communicating with each other. There should be something that is in common to those students because they've got the same degree. We also talked that the core should not be more than 1/3 of the credits in the program. And this was a very contentious issue. People, obviously this is quite specific, but they didn't want the core to be the entire program. If you offered a generalist MPH, that's fine, but have some mastery, some depth in the different areas, and maybe all of the areas have the same levels of depth. And again, the core need not be the 5 courses. It has to be more integrated. And I've got 3 slides here. You may have seen these, but this was really the big issue that came out in terms of what ought to be included in the core. So there are a few slides, and I know there are a lot of words on these slides, but those of you in the audience who are teaching the core courses are going to look and say, that's Biostat, that's EH, that's EPI. It wasn't meant to be set up that way. So these are the things that want to be seen in future MPHs. Students have an understanding of the history and philosophy of public health, its core values and functions. Understand the methods and tools to collect and analyze data. Understand population health concepts and approaches that deal with concerns of populations. Biological, environmental, behavioral, cultural, and other factors that affect human health. Now here's where you can see that we could not really get to throwing things out, so we just lumped everything together. Which unfortunately is useful but not useful to see things like this. Understand how to identify opportunities to promote health. Understand project management and implementation, budgeting, human resources, assessment and evaluation. Understand how the U.S. healthcare system works. Legal, ethical, economic, and regulatory dimensions of healthcare. All of these things want to be included in the core of the future MPH. Understand public health communication and social marketing. Cultural context of public health issues. How to function within and across organizations. And everything ought to be global. That was really the bottom line of all of it. So as you look at all of these things, now remember a few seconds ago I said the core wants to be less than 1/3 of the program, yet we wanted to include all of this. So this is one of the struggles that we all have to face. How do we do all of this in less time with our students? So there's a real challenge now to balance the breadth versus the depth. More core in fewer credits. And the part that's the hardest, which I'll tell you about more when I tell you about what we're up to at our place, is what's going to go. Nobody wants to talk about what's going to go. It's more exciting to talk about, well, we'll add this and we'll add this and now we'll do this. But something has got to go out the other end, and that's really, really hard. And also, how do we integrate? How do we put courses together that used to be standalone? And how do I, as a biostatistician, make sure that my stuff gets covered in the way that I think is appropriate and doesn't get too watered down or too lost in the mix? What all of us fear is that our piece won't be covered enough. And particularly in areas where students find it difficult, and everybody finds something different difficult, but a lot of students don't love biostat, let's face it. But I don't want them to not get it, they have to get it. So we have to be careful about that. Concentrations have to be mapped to the workforce and be adaptable. And again, that's really hard because you need a crystal ball. Because you have to try to predict what's going to happen, set your program up, and there's often a lot of time that goes in between those two things. And then how do we know we're effective? So competency-based education, as you all know, is very hard work. So let me tell you a little bit about what we're doing at Boston University, given the changing landscape, the expert panel report, and what we're trying to accomplish at our place. So I'll tell you a little bit about our school, how we went about this process, what we're proposing to do, and some of the challenges. And you can stop me anywhere in here because you can relate to this. I think you're in the midst of this now. So just in case you don't know, Boston University School of Public Health is one of 17 schools at Boston University, which is a large private research institution in Boston. We are currently ranked 11th in the U.S. News and World Report, if you care at all about those rankings. We have about 150 full-time faculty in 7 departments. We offer 8 concentrations. They're generally speaking tied to the department, but our Department of Community Health Sciences has 2 concentrations, social behavioral and maternal and child health. Everything else is one-to-one. So Biostats has a Biostat concentration, EPI, global health, and so on. We have a number of dual degree programs with the MPH, so we have an MSW MPH, MD MPH, and so on. We have 4 MA MS programs in specific disciplines, 4 PhDs, and a DRPH. We have had a lot of growth in our MPH program over the last couple of years. We're right now about 1,000 students in the school. That's all programs combined. And we bring in about 400 MPH per year. So that's the size of our MPH. And we currently offer the MPH in various forms. So we allow students to come in and do the program full-time, which they can do as quickly as 16 months. And so that if they enter in the fall, we have a fall admission cycle and a spring. So if they come in September, the fastest they can do it is a fall semester full-time, a spring semester full-time. They do their practicum in the summer and 1 more semester. So they can finish the following December, 16 months. And many of our students, increasingly, they've come in wanting to do the program full-time. It used to be that 40% came in interested in full-time study. Now it's up to 80%. And they are also allowed to switch to part-time along the way, and we want them to spend more time with us, but understandably they want to get out and be doing the things they want to do. Although 80% come in planning to do full-time, only 25% go through at that pace. So a lot of those who planned on going full-time change their mind along the way and scale it back a bit. So most of our students spend 2 years. We also have a part-time program. And so we have a lot of students who come to us on a part-time basis, and that's fine too. Although, as you are facing, trying to balance all those different options for students, which we don't want to lose because they're important to students to have that flexibility, makes it difficult to think about curriculum redesign. So here's how we started the process. A couple of years ago, we had an assessment and redesign group. This was just an informal group of faculty. And we started looking at our program, talking about our program and what we could do better, but really didn't have a complete overhaul in mind. It was really just trying to, do quality improvement. And we did things like a SWOT analysis, looked at our strengths and our weaknesses, where we had trouble and what we could build on. And we're just marching along with this. But then the dean said, we really need to look at this program given all the changes nationally, the changes in the students, the changes in where the MPH wants to go. So we really need to ramp this up. So our leadership put together a task force, and we called our project MPH 2015. And I said to a group this morning, that seemed like a fine name at the time. Because 2015 seemed like a long way away until now, when it does not seem that far away. But we haven't changed the name yet. We're still going under MPH 2015. And so we put together this group, and we met every other week for 9 months. And we spun out 5 working groups to look at specific pieces of our program. We had a core working group, a working group on concentrations, one on the Culminating Experience, one on the Practicum, and one on ways of teaching and assessment. And they reported back. They all met and then reported back to the task force. We had town meetings that were open to faculty, staff, and students. And we had regular updates to multiple groups. I would go around with my sidekick to all the department meetings and to meetings of students, to meetings of alumni, and so on. We had 2 full-day retreats of the school leadership over the last year, and it was a very open process. And I think this is the only way, as you're doing here, to do this kind of thing, because it's too difficult and too painful for faculty to feel left out of the process. So we tried. Now, does that mean everybody's comfortable with it? No. But we tried to be as inclusive as possible in the process. So why did we even do this in the first place? Well, we had done departmental reviews. Each department essentially was trying as best it could to always update their curriculum, make sure it was current and solid, but we hadn't really taken a program-level view. And when we took a program-level view, we found that we had some redundancies and some inefficiencies. And just some easy examples, in the core course in Biostat and in the core course in Epi, we were teaching some of the same things. Now, it's not bad for students to see things from multiple perspectives. We don't want to lose that piece, but we don't each need to teach the same thing in the same way. So we thought there were places where we could be a little bit more efficient. Our student body has changed very dramatically. When our school was first developed as a school in the late 70s, it was really a part-time school for mid-career professionals. That's what it was designed for. Now, it's almost all younger students coming in who have less experience. They're not all right out of school. Some are. We don't have a work requirement. Many of our students have a year or 2 experience, but they're not required to have that. We still have the mid-career professionals, but they don't make up the majority of our student body. As I said, lots of our students are choosing full-time study, which is good and it's bad. It's good because they want to come and there's structure there so we can set things up knowing they'll be around, but a lot of the faculty feel like there's not enough time with them. If they're coming in with less experience and they're getting out quicker, what can we really do in a condensed period of time? We also found that even though we were advising against it, some students were putting certain core courses off until the end. And you know what they are. And it's not Biostat. At our place, we had advised strongly that students take Epi and Biostat initially. We also have, one of our course requirements is a course in health law. So we, in our program, advise students to do Epi, Biostat, and law first. The Epi and Biostat because we thought they were foundational. They ought to know that. And the law because a lot of students struggled with it. And we wanted them to find that out early rather than late. And so a lot of them were putting off EH and HPM until their last semester. And so there's nothing foundational about that if they're doing it in their last semester. And so that was a problem that we were trying to fix in our redesign. So just in terms of these working groups that we put together to think about the 5 areas, these are the questions that we asked of those groups. And certainly they went off and talked about lots of things. And here's where, chime in if there are other questions that you have. So in terms of the core, we had to ask, what does every MPH student need? Now here's where it gets hard. So I teach Biostat. I want every student to know all this stuff about Biostat. Well, guess what? They don't need to. They don't need to. The Biostat concentrators need more, but they'll get it in the concentration. So you have to ask, what does every student need to know? And then you also, on the other side of that same coin, have to ask, if this is their only exposure to such and such, what is sufficient for them? So you have to find that right balance. And I should have said this at the beginning. I have no answers for you. I'm just throwing out a lot of questions. It might be a little late for me to say that. The other is, are the core requirements the same for all students? We had, in the past, 2 levels of the Intro Biostat course, 2 levels of the Intro Epi course. this one for the concentrators or those more comfortable, and this one for those less comfortable. It got so we couldn't manage it because as our student body grew, we needed more sections of each one and we couldn't handle it. So we made one course for each. I don't know if that's right or wrong, but that's what we did. Then we asked, how do we integrate the core, and then how does this integrated core feed into the whole program? How many credits should it be? Well, we currently require students to do 6 core courses, each is 3 credits. So, of course, the faculty dealing with this said, okay, we'll make it 18 credits and just split it up and repackage everything we have right now. And that's not where we ended up. But that was a difficult conversation. And then how do you know what should students be able to do after finishing the core curriculum? And how do you know they can do it? And that's really difficult. And then for the concentrations, what concentrations should we offer? And I have to tell you, we struggled with this. We thought we were doing great on this until we submitted our final report from the task force. And the reviewers, our governing council, looked at it and said, well, did you think about this concentration or that concentration or that? And I realized that we were so comfortable thinking within our own areas that we didn't get out of the box at all. And so if you are now thinking about what concentrations, try to think about what do students really need, what would be exciting for them. We were a little bit too insular in our thinking in that area. How many credits should it be? How should courses be structured? Should all concentrations require writing and presentation skills? This was something that comes up for us. Our students and employers who get them sometimes say they can't write and they don't have good presentation skills. And some faculty argue, is that really my job to do that? I don't know. But we want to make sure they come out and can do that. And how does this get integrated? What's the right level for someone in a concentration? How much must they master? Our practicum, we asked, what is the minimum commitment? We have students with lots of different experiences who come into our program. Should we allow for waivers and alternative pathways? We don't allow people to not do the practicum, but we do have alternatives. Is that appropriate, or should everybody do the same thing? Should we be more prescriptive in where they go and what they do? As the program gets bigger, that becomes difficult to manage. What should they be doing in the practicum? And how do we integrate this? So a big part of this, you see the same bullets are repeated, is we're trying to integrate all the components. We have a pretty big school and a lot of offerings. We got a little bit too disjointed. Everybody tried to fix their piece, but it wasn't all coming together. And so that's really what this effort was an attempt to do. And then our culminating experience, should it be school-wide or concentration-based? We have always been concentration-based, and that's what the MPH expert panel is suggesting, but not all of our CEs were equal. The students weren't gaining what we thought they should in the culminating experiences, and to be quite honest, a lot of our students were dealing with the CE as a checkbox. Let me just get it done and get out of here, when it really ought to be something very meaningful and substantial, and it wasn't. It was just getting pushed off to the end. And again, how should it be integrated? And this working group was a very important one. How do we actually do better teaching? There are lots of new ways that people are suggesting for teaching and assessment. What are the best practices and how can we bring them into the whole program? And how do we engage our faculty in these new practices? And this is very, very difficult, and I'm glad the dean is here because one of the issues was, who's going to cover my time for doing all this stuff? And that really came up quite a lot. As you know, it's going to take time to learn new things. So as we thought about our redesign, we tried to focus on competencies, what our students will be able to do when they leave. So our real goal was to produce graduates that employers will want to hire. So we want to produce students so that an employer looks and says, this person graduated from the BU School of Public Health, we know what they can do. And that's really what we're trying to do. And then we need to put in a system for ongoing monitoring and evaluation. It has to be continuously aligned with the field. Again, we had been doing that, but it wasn't systematic enough. And so we're shifting, as you all are, to evidence-based education, focusing more on the outputs than the inputs. It doesn't matter if we have great students with really good GPAs and good GREs, and if our faculty are writing all kinds of papers. What matters is that our students can do things in the field. And so that's the focus on the outputs. So we had to really think about measuring what our students can do and knowing where the gaps are and building in a feedback loop. And so that's what we're trying to do right now. And assessing competencies is difficult, it's multi-layered, and it has to be continuous. And so these are all the pieces, and I've talked with Maria about this. You are doing a lot of these things now, and we are trying to do them more systematically than we had in the past. So this is what we came up with in terms of our program. So we are proposing that our program has these elements to it. An integrated core curriculum, and I'll show you what we're thinking about that. The concentration with more sequencing to build skills. Still options for electives where students can either stay within their concentration to do more or go to another area to complement what they're doing. The practicum we changed a bit. Our culminating experience we're trying to elevate. We have a career development program which we think is a really important part to our program. We have over the last 5 years built up a career services office that does a lot of work with our students to prepare them for public health careers. In addition to them working with the students, they work with the faculty because they're in touch with the employers. They're hearing, they are on the ground with what the employers want. They feed that back to the departments, and we can know students need this particular skill or these kinds of skills. We can then try to build them into the curriculum. So they are a huge and important piece for us in our program, and we need better teaching, advising, and assessment. And we think all of these pieces taken together will build professional skills and professional confidence in our students. So here's what it looks like. So right now, we require students to take 6 core courses. So the 5 that you recognize, and we happen to have a Department of Health Law, Bioethics, and Human Rights, and we require our students to take a core course in that area. So we are shifting away from this to 3 courses. A quantitative methods course, individual, community, and population health course, and a health law, policy, and management course. Our goal is to develop these 3 courses and have students take these 3 instead of those 6. Now, clearly, EPI, Biostat, and some of EH fits into quantitative. But the idea is that all of the areas fit into each of these in varying degrees, and there's overlap. But this is what we're trying to do. In the concentrations, these have to be mapped to the needs of the field. So as faculty in our school are proposing new concentrations, we want to know what are the jobs students are going for. And the way we're setting up the concentration is, what are the jobs and what are the skills required for that job? Now, what do you need in the way of a curriculum to set that up and make sure they can do it? So they have to be skills-based, and we're trying, this isn't hard and fast, but something like 4 courses that people take in sequence. We already have the sequencing in some of our concentrations. They've always been that way, but some of our concentrations are not that way. And not to pick on global health, but that concentration was very flat for us. Students could take 4 courses, but they'd be one over here, one over here, and one over here. And they weren't really going deeply into anything. And so we're trying to do this with all our concentrations going forward. And then for some of our larger concentrations, there's an opportunity for students to go into a particular focus area. So this is what we're thinking right now. So the larger font, those are the concentrations that we're working through right now. So the usual ones, that biostats, environmental health, EPI. But in global health, what we were finding was that a lot of our students in global health didn't have the skills to go out and do the jobs. And some of them would realize this during their time with us and pick up a second concentration, like EPI. So they'd end up graduating as global health / EPI concentrators, duals. But what that did for them was limited their flexibility in the program because they have to satisfy the requirements of each. So what we've done now is we're proposing to get rid of the dual concentration but put together the ones that are most popular for students. So we have a research and evaluation focus under global health. That's the global EPI combo. Design and implementation of global health systems. That's the global health policy and management combo. Addressing disparities in global health, that's really the global health social behavioral combo. And then we have a pharmaceuticals and public health program, which has gotten really popular. So this is for students who are interested in the pharmaceuticals field, not necessarily working in the pharmaceutical industry domestically. There's a lot of global interest in pharmaceuticals. And then we're proposing something in public health informatics. I was talking with the Biostat and Epi group this morning. We don't really know what we mean by that right now, because informatics means something different to everybody. So we're trying to figure that out. But it's certainly, every time you put that up, people say, oh, that's good. Yeah, you need that. We don't really know what that is just yet. So our practicum, we're bumping up the hours. We were much lower in terms of the requirements, so we're going up to 240 hours in the field. We will build in options for students so that they can tailor it to whatever their background and their professional goals warrant. And we'll here try to focus it more on the concentration. We have a lot of opportunities in Boston, so we're trying to capitalize on those. We have several opportunities for students which are combination academic practicum options. So they go, for example, in a group of 24 students to Kenya for 6 weeks, and there's a didactic piece, and then there's a field-based piece. So they get some academic credit, and they can do their practicum at the same time. And then, as I said, we're doing a lot in pharmaceuticals. And then in terms of our culminating experience, the key here is the second bullet. We wanted to make sure that this produced a discrete work product, so that students, at the end of their culminating experience, had something to show to a potential employer to demonstrate what they could do. And that needed to be relevant to the job they were going for. And our career development program, we're really proud of this. This office works with students to build their tools and techniques to conduct a job search, to negotiate a job offer, and to go out and find a job. And this, I think, is really, really important. And I was telling some people this morning, when we get up and talk about to our accepted students, this time of year we have all accepted students, and they've been accepted to multiple schools, and they're choosing. And I get up and talk about the academic programs, and they say, okay, fine. And somebody talks about research, and they hear him. The woman gets up and talks about career, and they are all over that. That's what they want, and especially the parents love that. But it is really, really important. It's been very helpful in our curriculum redesign. And then we have teaching, advising, and assessment. As our program has gotten bigger and more complicated, as our students have tried to go through faster, we have not kept up in terms of our advising. It's hard for faculty to know all of the courses that are being offered and how to put them together in the best way for students. So we really need to work on that some more. And it's not a failure on the faculty's part. It's just a difficult task to stay on top of a complicated program. So we need continuous quality improvement in academic and career advising, and more on the assessment piece, which I've already made that point. But that's just something that has to be part of our program. And this is just a sample. We all like to draw pictures of what the program looks like. So we're hoping that students who come full-time will take the core curriculum and their first concentration course when they come, because students don't just want to take the core courses when they enter the school. They want to get into their concentration. That's what they really care about. And then they'll take more courses over time. So this is fall, spring, summer. We offer courses in the summer and another fall. And then again, the career development program is running right alongside it. And in addition to workshops that teach them negotiation and all that business, we have the career development staff plan on coming.
Your conference is scheduled to end in 2 minutes.
You're recorded.
Okay, now I'll really tell you what's going on. So they'll come into the core courses at the beginning to tell students these are the kinds of jobs that people can do, because we find not everybody understands what the options are available to them. So this is what we're thinking in terms of the program. So this is difficult. The curriculum redesign is difficult, and we'll talk much more about this, I know, but it has to be supported by leadership, and we have that and you have that. You have to have clarity in the goals. What is it that you're trying to achieve? What are you setting your program up to do? You need evidence for change. This is what I'm facing now. We have a lot of recommendations out there. We've got nice pictures that show what we're trying to do. And people say, why? Why are we doing it? And they keep saying that. It's like some of them are like 2-year-olds. Why? And you can't say because I said so, because it doesn't work. So you have to have evidence. So there's, you can change for change's sake, or you can change to do something different. We can't just change for change's sake. It's too much time and effort, and nobody wants to do that. So there has to be clear evidence, and we did find some issues that we're trying to fix. We have to minimize barriers for our place. We're all very stuck in our departments. We don't mean to be, but we are. And it's hard to get outside of that. And we have to shift to competency-based education, but that's not a small task. So it's completely turning around the way we set up programs. Rather than, I am a new faculty member, this is my area of expertise, why don't I do a course on this? That's the way most of our curricula develop. Now it's, here's what we need, who do we have that can possibly do it? So it has to.
Your conference is now over. Goodbye.
It has to be okay. And that's the last slide.